Do you have red, irritated, or itchy eyes? This might be due to things in your environment like dust, pollen, and bacteria collecting on your eyelids and eyelashes. In this video, I'm going to share with you my top 3 ways to clean your eyelids and eyelashes at home coming up. Hey guys, it's me, Dr. Smith with the Stone Canyon Eye Show, the channel that gives you the best tips and products to keep your eyes healthy, seeing clearly, and looking good. So if you're new here, consider subscribing and hit that bell to be notified when new videos come out so you don't miss any new ones. And by the way, watch until the very end of the video where I give you one of the best secrets eye doctors these days are using to clean eyelids and eyelashes in office that many people these days are greatly benefiting from. So here's tip number 1. Use pre-moistened or pre-medicated eyelash wipes. There are a few brands out there that are commanding a lot of attention right now. A few of those brands are Systane for one, and you might recognize this from the Systane artificial teardrops that are very popular out there. Optase is another brand out there that's awesome because it has tea tree oil and hyaluronic acid in it, and this one's known for comfort of use, the Optase. Another one, for example, is OcuSoft. This is one of the #1 brands recommended by eye doctors right now for washing the lids and the eyelashes. So here's how you use them. Start by washing your hands well, then open the package, remove the wipe, wrap it around your finger, close your eyes, and wipe your eyelashes and eyelids back and forth with a gentle side-to-side motion for about 10 seconds. And then repeat the steps for the other eye. And just to be safe, be sure to always read the directions on the back of the label to make sure there aren't any subtle differences. For example, the Optase and the OcuSoft formula, after washing your eyelids with these, the directions say for best results, leave them on the eyelids without a rinse. Versus Systane, the directions say after cleaning the eyelids with this product, rinse both eyes with clean, warm water and pat dry. So watch for any subtle differences in the directions. One of the main benefits of the pre-moistened lid wipes is the portability of them. You can use them at home, you can use them at work, you can even use them out on your morning jog if you want to. I'll leave a link below for some of my favorite lid wipes that I personally use, as well as the ones that we talked about. And watch my video where I actually do a comparison between some of these top brands that make these lid wipes, where I compare them for comfort and ease of use. And that brings us to tip number 2, and that's to use safe foam eyelid cleansers on your eyelids and eyelashes. So the same brands that make those pre-moistened lid wipes that we talked about also make, in a little pump bottle, foaming eyelid cleansers. This one is the Blephex brand right here. This one is Lid Hygienics brand. But these are nice because these are soaps that are formulated for safe use on the eyelids and lashes that you can use at home in front of the sink or in the shower. Here's how you use them. You wash your hands, remove your contact lenses, apply some of this foam to your fingertip, and then with a lateral side-to-side motion, gently clean your eyelids and eyelashes for about 10 seconds. And then before you open your eyes, blot the eyelids with a clean, dry towel, and then follow up with a rinse, and then you're done. The nice thing about this approach is that you can trust that this soap is formulated for safe and effective use on the eyes. And obviously you want to try to do this with your eyes closed and minimize the amount of soap getting under the eyelids, but it is formulated in a way so as to not cause damage to the surface of the eye if some of it does enter the eye. I'll leave a link in the description for some of my favorite eyelid soaps that I personally use and use in the clinic. And that brings us to tip number 3, and that's to do a warm compress on your eyelids before you actually wash them. To do a warm compress at home, you can use a warm, clean washcloth that has been soaked in warm water, where you wring it out a little bit and place it on your eyelids and let it sit for about 10 minutes. But really the most effective way to do a warm compress is to use an actual heat mask that is designed to do these warm compresses. You place these in the microwave for about 15 to 20 seconds, take it out, place it on the back of your hand, make sure it's not too hot, and then you place it on your eyelids as you're sitting in a reclined position, about like this, not all the way on your back, because that can be damaging to the cornea. And after you're done with the warm compress, after it sat for about 10 minutes and cooled, remove it and then go ahead and do your eye wash after that. At my clinic, I use a special microscope equipped with infrared light to check the health of these meibomian glands, and sometimes a special visit to my office is recommended where we actually heat and express a patient's meibomian glands in an extremely comfortable and efficient way in the clinic. So make sure and ask your eye doctor about the health of your meibomian glands, especially if you suffer from dry eyes or red irritated eyes in general. And check the description below for a link for my free ebook called Dry Eyes to Wet Eyes that I wrote that gives you a ton more information on a lot of things that you can do at home to treat your dry eyes. All right, before I leave you with that awesome bonus tip, take a second and smash that like button for me so I know that you're getting some sort of help out of this video. And it also helps me know if I should make more videos like this in the future. Okay, and now for that bonus tip. So eye doctors have the capability of seeing eyelashes and lid margins under their microscopes on a very close, detailed level. And a lot of times we see when we look at the lashes that there are bits of flakes and collarettes and clumpy material that collects on the base of the eyelashes and on the lid margins. And what this is, it is bacterial overgrowth. It is a plaque-like biofilm that grows along the lid margin and collects on the eyelashes. And when this sets in, it is very hard for a person, even after they're doing lid washes, to get some relief from chronic redness and irritation. So the secret is this. Eye doctors can use special instruments like one like this called Blephex to go ahead and remove that biofilm off the lids and the eyelashes. This is what takes place with that Blephex treatment. A patient's brought in, the chair is slightly reclined, a mild anesthetic drop is placed on their eye and the cleaning begins, and after about 10 minutes they're all finished and that biofilm is removed. This is a common procedure that we do in my clinic and one that I have done on myself from time to time just to make sure I have the best eyelid hygiene I possibly can. Definitely makes a difference on making those eyes feel good and helping them look healthy and clear as well. And if you wear contact lenses, removing that biofilm is a huge way to quickly boost comfort of those contact lenses. That biofilm just dumps toxins into the tears that causes inflammation of the eyelids and leads to contact lens discomfort as a result. Okay, so question of the day, have you ever noticed any flaking or any clumps collect on your eyelashes? And has it ever caused any eye irritation or contact lens discomfort? Let me know in the comments below. And as always, I'm here for you and your eye health. If you have any questions about the products used in this video or discussed in this video, check out the description below for all those links. And I'll see you in the next video.